Hi, Kay. I'm a nurse practitioner with the Coumadin Clinic.
Hi.
So I understand that you've started on Coumadin for the first time.
Yes.
Wanted to give you a little bit of information about it.
Okay.
First of all, very important and crucial medication. Important to take at the same time every day, not to miss a dose. So there's a few things that you need to know about Coumadin. First of all, you'll need to have labs drawn at least 3 days after you're discharged from the hospital. Depending on who will be managing your medication, that could be primary care or that could be a Coumadin clinic. Either way, your INR will need to be drawn either from that Coumadin clinic or from a local lab. If you miss a dose, it's important to not ever double dose. So if you skip a dose, don't take 2 the next day. And there's a few things that you need to know as far as interactions with this medication. Medications can interact with it, and the person that you'll be meeting with, either at the Coumadin clinic or your primary care, will go over all of that. We're going to give you a book today that covers all of this information as well. Some medications that you shouldn't take while you're on this are NSAIDs, and that would include ibuprofen, aspirin, Aleve, those kinds of over-the-counter medications. If you need to take an over-the-counter pain reliever, you can take Tylenol.
Okay.
Some foods that interact with this medication are those that contain vitamin K. Vitamin K would reverse warfarin action, and so at least limit foods such as most green leafy vegetables, broccoli, Brussels sprouts, green tea. In this booklet, there's a list of medications, and they'll go over how to eat foods that are high in vitamin K. That doesn't mean you can never eat vitamin K foods, but there will be some adjustment with that. There is one food that we ask that you don't eat while you take this medication, and that is grapefruit. There's an enzyme in it that can interact with the medication.
Oh, okay.
So that's really the only food you need to avoid.
Okay. So I go to a outpatient lab or Coumadin clinic then to get my INRs checked, and how often will I do that?
Initially, you'll be doing that maybe even as often as a couple of times a week. That as they stabilize you and get you into the right healthy, safe range, then that won't have to be nearly as often. It depends on the provider as far as how often that will need to be done after you're stabilized.
Okay. And do I take Coumadin with food or can I take it with my other medication?
With most medications, it's not a problem.
Okay.
We usually ask that you don't take it at the same time as an antacid, but it's fine otherwise, with food or without.
And just be sure I take it the same time of day.
Same time every day.
Okay.
That's correct.
Oh, this is great information. Thank you.
You're welcome.